I'm Lynn Friss Feinberg with the AARP Public Policy Institute, and it's my great honor and my privilege to be moderating this session after we've heard from the Spitalis to frame the issues of integrating healthcare and social services for people with serious illness and to identify the gaps, challenges, and the opportunities. This is a critical public policy issue that can no longer be ignored because of the aging of our population, because of the number of people living with disabilities who are aging in place, and because our current healthcare system is expensive and places enormous burdens on people with serious illness and their families. And it doesn't address everyday needs, as we've just heard. Before we begin, I just again want to thank the Spitalis, Marianne, Frank, Andy, and Nicole for sharing your lived experience and how the dysfunctional and complicated healthcare and long-term services, as I would say, non-systems, really failed you when you moved to Maryland for those first 21 months because of the lack of care coordination. But you reminded us that serious illness and disability impacts the person as well as the family. And that is why we must transform care delivery to support person and family-centered care to meet the health and social needs of people with serious illness and their families. Better integration of healthcare and social services is long overdue. We've been talking about this for years, for decades, in the case of myself, who've been working on these issues for 35 years or longer now. It is time, really, for our country to make a collective commitment for a more humane and caring society to address really the artificial separation that we have between medical care and functional needs in daily living, to address quality of life and well-being, and to address the needs of family caregivers too, because as we saw, families, Marianne and Nicole, wife, mother, daughter, are really the integrators of healthcare and social supports. Value-based strategies and the recent enactment of the Chronic Care Act and the Raised Family Caregivers Act that will establish a national strategy for family caregivers opens the door to a more integrated and coordinated range of benefits and supports in the workplace too, like paid family leave, because we heard about Nicole having to take time off from her job to help her sister and her parents. So we are now going to hear from two exemplary and provocative leaders in the field to frame the issues and talk about the centrality of supportive services to people with serious illness and their families. Their bios were in the briefing books, but let me just very briefly introduce each of them to you. First, we'll be hearing from Lauren Taylor, who is a health services researcher at Harvard Business School, where she's earning her doctorate in health policy and management. She has co-authored a highly acclaimed and widely read book titled The American Healthcare Paradox: Why Spending More is Getting Us Less. And then we will hear from Robin Stone, who is Senior Vice President of Research at Leading Age here in Washington, D.C. Dr. Stone is a noted researcher and internationally recognized authority on long-term care and aging policy, and has held senior positions, policy positions in both the U.S. government and the private sector. And then following Lauren and Robin's presentations, we'll have an opportunity for discussion and for Q&A. So without further ado, I'll turn it over to Lauren.